Welcome to Neural Newscast for Wednesday, January 14th. I am Thomas Keene.
And I'm Vanessa Calderon. We're starting today with some absolute administrative whiplash coming out of Washington, D.C. right now, involving about $2 billion in federal funding.
That is right. Late Tuesday, the Trump administration really sent shockwaves through the healthcare sector by issuing hundreds of termination letters for grants that support mental health and addiction services. These cuts, which are managed through the Substance Abuse and Mental Health Services Administration, or SAMHA, were actually set to take effect immediately.
Right. It was basically an overnight wipeout. One advocacy group, Mobilize Recovery, said they lost $500,000 just like that. We are talking about programs that handle overdose prevention, naloxone distribution, and peer recovery. But Thomas, in a wild twist, shortly after these reports started circulating, the administration actually reversed the decision.
Yeah, and the scale of the initial cut was massive, potentially affecting over 2,000 grants nationwide. The reasoning provided in the letters was that these programs no longer aligned with the administration's new priorities for reshaping the national health system. But from a practical standpoint, Vanessa, that kind of sudden stop would have effectively dismantled the frontline capacity for street-level care.
Exactly. Imagine running a clinic and waking up to an email saying your doors have to close today. Experts were warning that this wouldn't just be a budget issue, but a crisis measured in lives lost. Even though the funding is being reinstated now, the scare has left a lot of providers feeling like the safety net they've built is incredibly fragile.
It really raises questions about the stability of long-term infrastructure in the public health sector. If grants can be terminated and then reinstated within a 24-hour news cycle, well, it makes planning for future facilities and staffing almost impossible.
Totally. It is definitely high-stakes drama for people who are just trying to help others stay clean or get through a mental health crisis. Hopefully, the reversal means the lore of this particular policy shift ends here, but I have a feeling the trust gap just got a lot wider.
While we monitor the fallout from those federal policy shifts, we have a heartbreaking update on a story out of Ohio that has captured national attention. The family of Monique and Spencer Tepe is speaking out following the couple's tragic deaths late last year.
This case is just heavy. Monique and Spencer, a young couple with 2 small children, were killed in their Columbus home on December 30th. Monique's ex-husband, Michael David McKee, is now charged with premeditated, aggravated murder.
McKee, who is 39, was a doctor. Police have characterized the shooting as a targeted, domestic violence-related attack. During a court appearance this week, his attorney indicated he intends to plead not guilty. I should mention, investigators have already linked one weapon found on McKee's property to the crime scene.
The family is really painting a picture of what led up to this. Monique's brother-in-law, Rob Misla, told Good Morning America that Monique had been struggling to get away from McKee for a long time. He described years of emotional abuse and torment. It is that classic, terrifying scenario where someone tries to move on, but the past just won't let go.
Right. The Tepes were clearly very loved in their community. Their funeral had over 1,000 people in attendance. Spencer was a dentist, and by all accounts, they were incredibly inviting people. It is a stark reminder of the devastating impact domestic violence has on the broader social fabric.
The only small mercy here is that their 2 young children were found safe inside the house. Now, the family says they are focused entirely on justice for Monique and Spencer and making sure the kids are taken care of. It is a tough one to talk about, Thomas.
It certainly is, Vanessa. We will continue to follow the legal proceedings as McKee has waived extradition to Ohio to face these charges.
Shifting gears to something more global, there is a significant move happening in the Middle East right now regarding our military footprint.
Indeed. Reports are coming in that both the United States and the United Kingdom are pulling some of their personnel from a major military base in Qatar. This is a significant development, given how central Qatar has been to Western operations in the region for, the last 2 decades?
Yeah, exactly. Qatar has always been that interesting middle ground, right? They host these massive bases, but also act as a mediator for some of the world's most intense conflicts. Thomas, what does this move actually say about the logistics of our presence there?
Well, it suggests a strategic realignment. Maintaining large-scale permanent personnel at Al Udeid Air Base is a massive logistical undertaking. If the US and UK are drawing down, it could point toward a pivot toward more mobile operations, or perhaps a reaction to the changing diplomatic climate in the Gulf. We have seen similar shifts as the military looks to modernize infrastructure elsewhere.
It is definitely a vibe shift for regional security. If the big players are pulling back even a little bit, it usually signals that the old playbook is being rewritten. We will have to see if this is just a minor adjustment or the start of a much larger exit strategy.
That is all for today. I'm Thomas Keene.
And I'm Vanessa Calderon. Thanks for joining us. For more updates, visit us online. Neural Newscast is AI-assisted, human-reviewed. View our AI transparency policy at neuralnewscast.com.